Ever get that feeling like you could sleep for a whole week and you crave salt like crazy, and maybe your skin's getting darker, even though you haven't seen the sun in ages? We're going deep on something today that's kind of rare, but it all connects back to things you probably have heard of. Addison's disease.
Yeah, it's like all these puzzle pieces that don't seem to fit at first glance. But then you understand how these little things, the adrenal glands, actually work, and suddenly it all makes sense.
Okay, so adrenal glands, those tiny things up by your kidneys, right? What is he even doing up there?
Think of them like your body's own little stress management team. They pump out cortisol whenever you're dealing with, well, anything tough. That's cortisol's job. But they also control stuff like blood pressure, even part of your immune system. Oh, and we can't forget aldosterone. That one makes sure your body holds on to the right amount of sodium and potassium, and that keeps your blood volume where it needs to be.
Right, because nobody likes feeling fainty. Low blood pressure is the worst. But back to these puzzle pieces. How do you know if you're just tired, or if it's actually this Addison's disease?
That's the tricky bit. The symptoms, they kind of sneak up on you, so it's easy to ignore them at first. You're super tired. Maybe you're losing weight without trying, feeling nauseous. Your muscles ache. It's like your body sending a message, but in a whisper instead of shouting.
So you got to listen extra carefully. But you mentioned your skin darkening earlier. That's not exactly your average I need a nap signal.
Exactly. Hyperpigmentation, that's what it's called. One of the more, shall we say, distinctive signs of Addison's. Think like darker patches of skin, almost like a tan, but in weird places, around scars, on your gums. Some people even get it in the lines on their palms.
Okay, I'm going to remember that one.
Yeah.
So how does this hormonal imbalance even happen? Do your adrenal glands just decide to take a vacation?
Sometimes it's actually our own immune system. It gets confused and attacks the adrenal glands like they're some kind of invader. That's called an autoimmune response, and it's the most common way people get Addison's disease.
Our own body's working against us. That's kind of rough.
Right.
But you said most common, so there are other culprits too.
Right. There are. Tuberculosis is one. Especially in parts of the world where, healthcare isn't easy to come by, it can actually damage the adrenal glands.
Tuberculosis. Whoa. See, that's not what I would have guessed. Makes you think about those history class lessons in a whole new light.
It really shows you just how connected everything in your body is. One system goes down, it can have these ripple effects everywhere. And tuberculosis isn't the only other cause either.
There's more.
Oh, yeah. Cancer. If it spreads to the adrenal glands, well, that can mess with how they work. And even just internal bleeding, like if you had a really bad injury or some medical conditions can cause it, that can stop the adrenals from making hormones too.
Wow. Okay, so it's a delicate system. We've covered the what and the why. But how do you actually figure out if you have Addison's disease? Blood tests, I'm guessing?
Exactly. Blood tests are the first step, yeah. They can show low sodium, high potassium. Remember how we talked about aldosterone before? And obviously they check your cortisol levels. But to know for sure it's Addison's, doctors usually do what's called an ACTH stimulation test.
ACTH, right, yeah. Refresh my memory on that one.
Sure. So ACTH, that's like the messenger hormone. It comes from the pituitary gland up in your brain, and it tells the adrenal glands, hey, make some cortisol. So in this test, they give you a dose of ACTH, the artificial kind, and then they see what happens to your cortisol. If it stays low, that's a big sign it's Addison's.
So they're basically ringing the doorbell to see if anyone's home, but with hormones instead of actual doorbells.
That's a good way to put it. Now, sometimes you got to do even more digging. There's this other test, the insulin-induced hypoglycemia test. Sounds scarier than it is. But basically it helps figure out if the problem is the adrenal glands themselves, primary adrenal insufficiency, that's what that's called, or if it's the pituitary gland that's not sending the ACTH signals right. Secondary adrenal insufficiency, that one.
So is the phone line down? Or is the person just not picking up the phone?
Exactly. And, this is what I think is really important to remember. Addison's disease, it's lifelong, right? It's not like you just take a pill and you're done. So what does that actually mean for someone who has it?
That's a really good question. It's not just about the diagnosis. It's about living with it every day.
Right. And the good news is people with Addison's can live totally normal lives. The main treatment is hormone replacement therapy.
So basically you give your body what it's missing.
Exactly. Think of it like giving your body the right tools to do its job. Hydrocortisone replaces cortisol, and then fludrocortisone replaces aldosterone. The key is getting the dosage right.
Because too little and you're not getting the full effect.
And too much and you swing too far the other way. That can cause weight gain, high blood pressure, even weaker bones over time. It's all about finding that balance.
Which is why it's so important to work closely with your doctor. Regular checkups, being honest about how you're feeling, all that.
100%. Your doctor, they'll keep track of your hormone levels, adjust your meds if needed, and help you if anything comes up. The more you know, the better.
Speaking of knowing, we've talked about those early symptoms, but what happens if it gets like really bad? Beyond just feeling tired. What's an adrenal crisis?
Yeah, adrenal crisis, that's when you know it's serious. Basically, your cortisol levels, they just bottom out way too low.
And those early symptoms, the tiredness, the nausea.
It's like that, but times 10. And it hits you fast, like really bad pain in your lower back, your stomach, even your legs. You might throw up, have diarrhea. Some people get confused or even pass out.
Okay, so definitely not a walk it off situation. What do you do if you think you're having an adrenal crisis?
Yeah.
Or someone you're with is?
Don't mess around. Call 911. This is an emergency room situation. They'll get you fluids through an IV, cortisol injections, the whole 9 yards.
So being prepared is super important. What are some things people with Addison's can do to be ready, just in case?
Having a plan makes all the difference. Little things like carrying an ID or wearing one of those medical bracelets, so first responders know right away what's up. And it's smart to have a cortisol injection with you, the kind you can give yourself, just in case.
Makes sense. That information, having it right there, that could be huge. This has been so informative. Really glad we did this deep dive. We've covered so much, like from those sneaky symptoms to full-on adrenal crises. So as we wrap up, what's the thing you hope people listening will take away from all this?
Honestly, just that Addison's disease is manageable. You can have it and still live a totally normal life. The key is knowing your stuff, working with your doctor, and being prepared.
It's about advocating for yourself, knowing what to look for. And hey, if you're suddenly craving potato chips 204/7, maybe ask your doctor about it. It couldn't hurt, right?
Exactly. A little curiosity can go a long way.
This has been fascinating. And for everyone listening, remember, this is just the start. We've talked about the physical stuff, the symptoms, the treatments, but living with a chronic condition, that affects you in other ways too, right? Your mental health, your emotions. So here's something to think about. How do you build resilience when you have Addison's disease? How do you handle stress? How do you live your best life, even with these extra challenges? Those are questions worth exploring. Keep those brains working, and we'll see you on the next deep dive.